I'm your host, John Lazarou. Listen, William Shakespeare once said that the eyes are the window to your soul. And I bet you never thought that I would be saying Shakespeare on this show. Come on, be honest, right? But anyway, your eyes can say a lot more about you. They can give some insight in certain medical conditions that you might be suffering from, whether you could be possible having a stroke, or the eyes can say, you know, whether you have high blood pressure or not, or maybe a sexually transmitted disease, cancer. But it can also say a lot about diabetes as well. And since November is National Diabetes Awareness Month and also Diabetes Eyes Month, we thought the best thing to do is to get us an expert to talk about how diabetes can affect your vision and can affect your eyes. And joining us today is Dr. Katherine Duncan. She is an ophthalmologist with GBMC Health Partners Ophthalmology. Dr. Duncan, I want to thank you for joining us today. We got a lot to get to, so let's get rolling, okay?
All right, sounds good.
Let's talk about, I mentioned about diabetes, giving health medical professionals some idea about a medical condition that someone might be suffering. Today we want to talk about diabetes. So let's talk. How does diabetes affect someone's vision?
Mm-hmm. So diabetes is a disease that affects the small blood vessels in the body, and one of those places that it likes to affect most is the eyes. And what it does is limit the ability of those small blood vessels to bring enough oxygen to the eye. And that results in bleeding in the eye, swelling in the eye, and scarring, and all of those things can contribute to vision loss.
So how common is diabetic eye disease?
It is pretty common and increasing in its prevalence as diabetes increases. So it's now the leading cause of blindness among working age adults in the United States. It affects around 8 million people in the U.S. And depending on the source you read, anywhere from 1 in 3 to 1 in 5 people with diabetes will develop some form of diabetic eye disease.
I think when you talk to medical professionals across the different landscapes of medicine and health ailments that somebody can have, everybody always says the earlier the better, right? Mm-hmm. So one of the things that you and I spoke about before our show today was not just if you have diabetes, but how important is it to have an annual eye exam? How important is it for you to see your eye care professional, regardless whether you have diabetes or not?
Yes, very important. So that's one thing I really wanted to stress today, that the very early stages of diabetic eye disease have no symptoms, meaning you don't see any change in your vision or feel anything going on in your eye. And it's so much easier for us to treat the disease in those early stages before it gets to the more serious levels, which are much harder for us to reverse. So even if you feel like you have very good eyesight and no problems with your eyes, it's really important to still come and see an eye professional once a year at least to get those eyes dilated so we can make sure we're not seeing any early signs of the disease.
So how do doctors diagnose and treat eye problems from diabetes?
Yes, so the way we look for any signs of diabetic eye disease is by dilating your eyes. The place that it tends to affect the eye most is something called the retina, which is the back layer of your eye. And when we dilate your eyes, we're able to look into the back of the eyes, and we can see signs of diabetes, which are little areas of bleeding, little areas that aren't getting enough oxygen, and growth of abnormal blood vessels in the eye. So this is a great image here. This is a retina that has significant diabetic eye disease. So when we look in the back of the eye, that white circle there is the optic nerve. It has blood vessels coming off of it. But what's abnormal are all those little red dots all around. Those are all little areas of bleeding. And then the yellow in the middle is swelling in the retina. So we can see all of these things in your eyes sometimes before you even notice anything's going on with your vision.
Joining us today is Dr. Katherine Duncan, an ophthalmologist with GBMC Health Partners Department of Ophthalmology. Quick question, we had some questions that came in prior to our show from those that are watching us today. The first question is, Dr. Duncan, how damaging is borderline diabetes to the eyes?
Borderline diabetes typically does not cause any problems in the eyes. So it would be rare for us to see diabetic retinopathy when you have just borderline diabetes. The better controlled your diabetes is, you have a significantly lower chance of having any problems with the eye. So borderline would be sort of the most controlled version of that. So we typically do not see any problems in borderline diabetics.
Sharon asks, how does the loss of eyesight ultimately occur at some point in patients who have type 2 diabetes?
So that's a good question, Sharon. Fortunately, not everybody who has diabetes is going to have the eye disease. As I said, the better controlled your diabetes is, the greater the chance that we don't see any problems in the eyes. So, not everybody is going to develop vision changes and vision loss, but if you do develop it, it usually is related to swelling and scarring in the eye from these changes that we looked at earlier.
Again, joining us today is Dr. Duncan, and I encourage those watching on Facebook and our studio audience to, if you have any questions, please feel free to submit them, and we'll have Dr. Duncan answer those questions as quickly as we can. Doc, just a couple things. How can managing your blood sugar help with diabetes eyes-related complications?
Mm-hmm. So the better you manage your blood sugars, the less the chance that you're going to have any problems in the eyes, as we said. So one thing that's really important if you have diabetes, something called your hemoglobin A1C is a great number to know. That gives us sort of a 3-month average of what your blood sugar has been. And if we can keep that number under, say, 7, the chance that you're going to have any problems in your eyes is much lower. So it's important to ask your doctor when you go in, what is my hemoglobin A1C? What is our target? And that way you're really involved in the process and know what's going on with your health and can protect your eyes and your other organs.
Okay. So, before our show, we talked about the complications that can happen to your vision from diabetes. And I think in our discussions, we basically broke it down to 4. Mm-hmm. So if you can just outline the 4 main eye diseases that can threaten your vision, mm-hmm. If you're someone who's been diagnosed with diabetes.
Sure. So the most common ways that diabetes threatens your vision would be developing diabetic retinopathy, which we looked at a picture of earlier. You can also develop something called diabetic macular edema, which is a term that describes swelling in the central retina. So this image here is something called an OCT, which is a machine we have in the office that kind of takes slices through the layers of the retina and shows us very fine detail of what's going on. So this big, large elevation in the retina is swelling that develops in the central retina with something called diabetic macular edema. And that tends to take away and blur your central vision when that develops. The other causes of vision loss that are associated with diabetes would be cataracts. Cataracts actually occur earlier and more frequently in diabetic patients than in the regular population. And lastly, you can develop a certain type of glaucoma that's related to diabetes. Most glaucoma is unrelated to diabetes, but there are forms of glaucoma that develop in diabetic patients.
We have a couple of questions from our audience. Laura?
Okay, so we have a question from an audience member named Michael. He says, diabetes caused bleeding in my eyes to potentially blind me. And forgive my pronunciation of this. A pars plana vitrectomy saved my vision. How does this restore vision, and is it generally successful?
Yeah, great question. So what it sounds like was going on in that case is when diabetes causes these changes to your retina, because they're not getting enough oxygen, your eye tries to grow new blood vessels to try to restore that oxygen to the eye. The problem is those new blood vessels are very leaky and they bleed easily. So what they actually end up doing is bleeding in your eye, and they can fill the cavity of the eye with blood that makes your vision very hazy and difficult to see out of. So there is a surgery for people who have that problem, which we call a vitreous hemorrhage. And what they do in that surgery is they go in the eye and remove the jelly that fills your eye to remove the blood from the eye, so that that blood is gone and you can see much better. And that is a relatively common surgery that's done in cases of a lot of bleeding in the eye.
Do we have any other questions from the audience? Okay, so let's go back. We talked about diabetic retinopathy, diabetic macular edema, glaucoma, and cataracts. Did I get them all?
Yes, you got it.
So let's start with diabetic retinopathy. What is, I guess, the main symptom or sign that someone might have early stages of diabetic retinopathy?
Yes. So as we mentioned earlier, unfortunately, in the early stages of diabetic retinopathy, there really are no signs. So that's why it's important to come and see us every year. But once it gets to a point that you do have symptoms from it, typically what you have is either blurring of your vision, or in some cases, if there's bleeding into the eye, as the gentleman described earlier, we can see that as floaters in our vision, or some people describe it as cobwebs in their vision. So if any of those things are going on, certainly get to an eye doctor right away.
Apparently, there are some stages when it comes to diabetic retinopathy. How many are there, and can you briefly describe each one, please?
Sure. So the main sort of categorization we make with diabetic retinopathy is whether it's what we call non-proliferative or proliferative. And what that means is those new blood vessels that start to grow, which I described earlier, once those start growing in your eye, we call it proliferative diabetic retinopathy. If they haven't grown yet, then it's a non-proliferative diabetic retinopathy. And there are 3 stages of the non-proliferative type. There's mild, moderate, and severe. And those stages are defined by how many little hemorrhages you have in the eye, how many areas of swelling, and sort of what we see when we look into the eye.
Joining us today is Dr. Katherine Duncan, ophthalmologist with GBMC Health Partners Ophthalmology. We are talking about how diabetes affects our vision. Dr. Duncan, quick question though. If somebody wants to come and see you or one of your colleagues in the department, what's the best way to do that?
Yeah, you could call GBMC's ophthalmology department to make an appointment. You can also go to the GBMC ophthalmology website, which I think they might be able to put up for you all today, and make an appointment. We have several physicians who do diabetic eye exams very routinely.
Awesome. We have another question from an audience member.
Okay.
Laura?
Okay, so we have 2 questions. I'm going to give both at once. So the first question is, can an optician detect diabetic damage? And also, does patient age affect the likelihood of diabetic damage?
Okay. Good question. So I know there are a lot of different terms for different eye care professionals. An optician is actually somebody who sells you your glasses, and they are not trained to do eye exams. So an optician, cannot do a diabetic eye exam, but an optometrist or an ophthalmologist can. So they're both trained to dilate your eyes, look in the back of the eye, and identify diabetic retinopathy. And does age affect your chances of having diabetic retinopathy? It's not as much age as it is how long you've had diabetes. So the longer you've had diabetes and the more uncontrolled it is, the greater the chance that you can develop diabetic retinopathy.
Do we have another question, Laura, from the audience? That's it? Okay. Let's stick with diabetic retinopathy before we move off to diabetic macular edema. Can the effects of, or can diabetic retinopathy be reversed? And if it can it be prevented or treated?
Yeah. So it can be prevented by controlling your diabetes really well. It can be reversed in some cases. We have different treatments that we use. If patients come in and have those abnormal blood vessels growing, we have laser treatments and we have injections in the eye that can reverse those changes. Once it gets into the very severe stages, it becomes much more difficult to reverse, and sometimes the end stage of diabetic retinopathy is something we call attractional retinal detachment, or a type of retinal detachment. If that has been present for too long, sometimes that can be difficult to reverse, but there are surgeries and things that we can try to address retinal detachments with. So many things can be reversed, unfortunately not the most severe cases sometimes.
Again, joining us today is Dr. Katherine Duncan, ophthalmologist at GBMC Ophthalmology, a great source of information. So I encourage you, those watching us on Facebook and our studio audience, that if you have any questions, please submit them so we can ask Dr. Duncan. All right, so we're going to move off diabetic retinopathy somewhat. We're going to talk about diabetic macular edema.
Okay.
Quick question, are they both the same? And if not, how are they different?
They're not the same thing, although they're associated in that they both occur in people who are having diabetic changes in the eye. Diabetic retinopathy describes the bleeding in the eye and the growth of those new blood vessels. Diabetic macular edema specifically describes swelling that occurs right in the center of the retina, which we showed the picture of earlier.
Okay, so what are the signs and symptoms of diabetic macular edema? And also, if you're diagnosed with it, can you stop it from getting worse?
Yes, so typically what patients notice when they're developing diabetic macular edema is a blurring of their very central vision. So typically there's no change in their peripheral vision, but when they're looking straight ahead, they may see blurring of people's faces or blurring of whatever they're trying to read right in the center. There are, the better you control your diabetes, obviously, that helps with not letting it get worse. But the main treatment for that is actually an injection of medicine into your eye, which works really well and is something that we didn't have 10 or 15 years ago, and has really changed how we treat this problem. And so coming in regularly to be monitored by a retina specialist if you have that problem, and getting those injections is really the best thing you can do, along with controlling your diabetes.
So let's talk real brief about how diabetic macular edema is diagnosed, and what are some of the questions that someone who's been diagnosed with diabetic macular edema should ask their ophthalmologist?
So we diagnose it by measuring your vision. If your vision is dropping, it's one of the things we look for. We can see that swelling when we look into the back of your eyes on your dilated eye exam. And then we also do that test, which we put up earlier, called an OCT, that gives us sort of a cross-section of the retina and shows us if there's swelling occurring in the center of the retina. If that is present, typically we treat that with injections in the eye, and a retina specialist is somebody who does those treatments. What I would want to know if I were a patient is, what does the swelling look like? How much swelling is there? And typically what the retina specialist does is obtain one of those OCT tests each month when you come to see them. And they compare, how much swelling there is and how effective the injections are. So I would ask my retina specialist, if it were me, how much swelling is there, how is it changing, and what is our plan going forward.
So, Doc, before we move on to glaucoma and cataracts, my last question about diabetic macular edema is, what are some, you mentioned about the injections, but what are some of the surgical treatment options for diabetic macular edema?
Yeah, so the injections are by far our most common treatment. In certain cases, laser can be used in the eye, and in even rarer cases, that jelly that fills our eye, which is called vitreous, can occasionally sort of tug on the retina and contribute to that swelling. So sometimes if they see that happening, we can go in and remove the jelly from the eye in the same way that we do when there's bleeding in the eye, and that can help to resolve that swelling in the retina. Again,
joining us today is Dr. Katherine Duncan, ophthalmologist with GBMC Health Partners Ophthalmology. We got about 10 more minutes left on our show, so I encourage our audience members and those watching us on Facebook, please submit your questions if you have them. Like I said, before we finish our segment today, we'll get Dr. Duncan try to answer them. All right, so let's talk about glaucoma. Why does diabetes cause glaucoma, and what are the symptoms, what might be some of the symptoms of those diagnosed with glaucoma who also have diabetes?
Sure. So most glaucoma, as I mentioned earlier, is actually not related to diabetes, but there is one form of glaucoma called neovascular glaucoma that can be caused by diabetes. And what happens is those same abnormal blood vessels that grow in the retina can grow in the natural sort of drainage structure in your eye. Our eye is constantly producing fluid and draining that fluid out. And if those vessels get into that drainage system, they block the fluid in your eye from draining out, and the pressure in the eye rises. And glaucoma is a disease where the pressure in the eye gets too high and starts to cause damage to the eye. It typically takes away your peripheral vision and slowly comes in, so you often don't notice until it's very severe that you're having a problem. So the way that we treat it, if you have that specific type of glaucoma, is to get rid of those abnormal blood vessels in the eye, which we can do with either injections or with laser treatments.
Okay, we have another question from our studio audience. Laura?
Okay, so this is jumping back a little bit, but it's relevant to injections. So one of our audience members asked what medication is injected regarding macular edema and what is the function of that medication. But I think it would be good to know about injections in general.
Yeah. Well, actually, the injections I mentioned are all of the same class, so this sort of applies to all those injections. They are something called an anti-VEGF medicine. And what happens is when the eye has diabetic changes, it releases something called VEGF, which is a factor that causes new blood vessels to grow. So if we inject this anti-VEGF, which blocks that signal, those new blood vessels stop growing and leaking in the eye, and it can help get rid of the vessels as well as the swelling in the eye. And there are several different named injections, but they're all of that same class.
Before we jump into cataracts, which was number 4 on our top 4 list, let's talk about maybe prevention and worst case scenarios with regards to glaucoma if it's left untreated.
Yeah. So unfortunately, the worst case scenario is always complete vision loss with glaucoma. Obviously that is an extreme outcome and does not happen to most people who have glaucoma. But the tricky thing about glaucoma is once you develop damage to the eye, we can't reverse that damage. So when we're treating glaucoma, we're always trying to prevent any more damage from occurring. What was the second part?
The
of the
other one
question?
was some prevention strategies with regards to glaucoma. Sorry.
Okay. So once we identify glaucoma in the eye, our goal is always to prevent the eye pressure from rising, which is what causes damage in glaucoma. And in the case of glaucoma related to diabetes, we can do that with those injections. In other types of glaucoma, we lower the eye pressure with different types of drops. And in some cases, we do certain surgeries that help the fluid from the eye filter out of the eye to keep that pressure low.
Again, joining us today, Dr. Katherine Duncan, ophthalmologist with GBMC Ophthalmology. Before we get to our next question about cataracts, again, that website for or that phone number to get some more information or to come make an appointment with you or your colleagues.
So the phone number for our office is 443-849-8084 to make an appointment, or you can go to our website, GBMC Ophthalmology. You'll find it if you look for that.
Awesome. All right, so cataracts. Let's talk about that. What are cataracts, and what are some of the symptoms, and why do they occur more in people that have diabetes than someone who does not have diabetes?
Okay, so a cataract is a clouding of the lens in the eye. We're all born with a lens in the eye that helps us focus and see. And as we get older, that lens becomes more and more cloudy. So most people develop a cataract with age, regardless of whether they have diabetes. But it does occur more quickly in patients who have diabetes. And the reason for that has to do with the fact that the lens of the eye can actually accumulate the high sugars in your body during diabetes. And those high sugars in the lens just start that process of clouding more quickly for the eye. It also can cause changes in the shape of that lens. So if you have blood sugars that are very labile, going up and down, you can actually notice changes in your vision and how well you see when you have diabetes.
Okay, just some quick hits about cataracts before we get to my favorite part of the program, which is true or false. Can someone who is diabetic have cataract surgery? And if so, when do cataracts require an operation? And here's the kicker one. Are diabetic cataracts reversible?
Okay, so yes, they're reversible, and the way we reverse them is simply by taking them out with a cataract surgery. Once you take a cataract out, you'll never form another cataract in that eye. So diabetic patients can certainly have cataract surgery. We do a lot of cataract surgery on diabetic patients all the time. The one thing I will talk about related to cataract surgery in diabetic patients is if you have macular edema, which we talked about earlier, sometimes having surgery in the eye can actually cause that macular edema to worsen or to flare up. So with patients who have a cataract and macular edema, we always communicate really well between the cataract surgeon and the retina specialist who's treating the macular edema. And often we time the surgery to be right after they have an injection to make sure that macular edema is under good control before we go into surgery.
All right. Dr. Katherine Duncan, ophthalmologist at GBMC Ophthalmology Health Partners. Okay, here we go, the favorite part of the show.
Okay, here we go.
True or false, okay? You ready?
I'm ready.
All right, it's easy. We're good. If left unchecked, vision loss due to diabetes can be reversible. True or false?
True.
Okay. You should seek an eye care medical professional only when you have issues with your vision or your eyes hurt.
False.
It goes back to what we talked about, making sure you get that annual eye exam with your eye care professional, whether you, like you said, an optometrist or even an ophthalmologist. Okay, insulin treatments cause blindness.
False.
Okay. Well, all people with diabetes are at risk for vision loss and blindness from diabetic eye disease.
True. All patients would be at risk for it, but the better you control your diabetes, the chance that you have any problems becomes much less.
Yeah.
So.
Guess what? You survived this segment.
Yeah.
Good. There you go. You can see clear now, right?
Yes.
No, I'm just kidding. Okay. All right. That's all we have time for today. If you have any additional questions, please feel free to place them in the comment section on our Facebook page, or please give them to Laura, and we can have Dr. Duncan try to answer them after the show. Stand by as the conversation about how diabetes affects us continues with Mary Beth Marsden on Greater Living Live. She's over there in the corner talking to Greg, talking as usual, not paying attention to me mentioning, oh, there she is, hello. All right. Before we close today, I want to thank all of you here in our audience and those at home for joining us today. And like I say every time, I hope that you guys all learned something new today. That is really the goal and the purpose of this show. And I know a lot of you did with our guest today, Dr. Duncan. Again, next time on To Your Health, we're going to be joined by a GBMC psychiatrist. We talk about depression. Look for more details in the coming weeks on our GBMC Facebook page. Dr. Duncan, I want to thank you for joining us today and giving everybody this great amount of information. All right? I really appreciate it. Okay, until the next time, cheers and to your health.